Good afternoon, everyone. Thank you all for being here today. Before I begin, I do want to acknowledge some of our local elected officials. We have with us school committee members Michael Ferranti and Anthony D'Ambrosio. We also have Joan Quinlan from Mass General Hospital, Mary Casesso from Cambridge Health Alliance. We have representatives from East Boston Neighborhood Health Center and Fallon Ambulance Service. We are here today, unfortunately, because we have been monitoring some increasingly concerning COVID-19 trends in the city of Revere. And we are taking a number of immediate actions to do what we can to reduce further spread in our city. These are not decisions that I make lightly, but it is my job as mayor to act in the interests of our residents' health and safety. Throughout this crisis, we have used data, and you see some of it behind me, to guide our actions, and the announcements that we are making today are a result of that data. I'm going to ask Dr. Kong, our chair of the Revere Board of Health, to share a little bit more detail about some of the data that you see behind me. But we are most concerned about our recent uptick in positive cases and increasing positive test rates that are much higher than the state's average. And in fact, the city of Revere is now the second highest in the entire Commonwealth. We must do our part here to ensure that our small businesses and others that are affected by a complete shutdown are not in jeopardy of losing any more valuable business. Our goal is to roll back some things and prevent a massive, drastic closure. And more importantly, and most importantly, we want to make sure that we have our kids back into classrooms in a safe manner. So with all that said, effective immediately, the city of Revere will be suspending all city events and programming. This includes our upcoming annual events such as our Fall Festival, Pumpkin Dash, and all adult recreational programming. And unfortunately, it also includes the Revere High School graduation, which was scheduled to take place Tuesday, August 11th. I'll say this about graduation. The students have dedicated a tremendous amount of time and effort to develop a thoughtful plan for a socially distanced ceremony at Harry Delarusso Stadium next week. It is incredibly difficult for me to have to ultimately decide that we cannot responsibly bring 1,500 residents and people to a single site, given the information and the data that we have today. We will work closely with the students to plan an alternative ceremony that poses fewer public health concerns. And this morning, I also convened an emergency meeting of our Revere school committee. And at my recommendation, the committee has decided that the Revere Public School students will learn remotely until this data improves. The Revere School Committee will formalize this decision at its Monday meeting. And Dr. Kelly, who is here today, thank you, Dr. Kelly, for being here, and her team continue to work diligently toward a September start date. Many more details will be coming out and will be made available to families as soon as possible. With the data that's before us today, we cannot responsibly plan to have children coming back to classrooms in September. And finally, in collaboration with the Commonwealth's Department of Public Health and the Community Tracing Collaborative, tomorrow the City of Revere will kick off a weekend of action, bringing awareness to recent data trends and containment strategies with a focus on Revere Beach, a focus on our faith communities, and a focus on Spanish and Portuguese speaking residents. Today, I'm asking that every resident do their part and share the responsibility together to help get us through this pandemic. Until our numbers improve and until the data says so, We will continue to have to make incredibly difficult decisions, but they are necessary decisions. And I'll close by saying this. I'm going to be getting tested myself. I want residents to please get tested, to please wear a mask, please practice social distancing, and please avoid gatherings where these safety precautions are not available. With that, I will introduce Dr. Kong, the chair of our Board of Health and a physician at Mass General Hospital.
Our contact tracing teams have been working since the beginning of this pandemic to identify trends and stay ahead of the curve. Recently, they brought to our attention a real-life example of just how quickly we can become overwhelmed again by this pandemic. One Revere resident recently contracted the virus at work, and they ended up infecting at least 20 family members and friends at various social gatherings. We know that individuals can become super spreaders through any number of gatherings, so we must limit our exposure to others as much as possible. Any gathering has the potential to trigger widespread infection. While young people may not be at risk of death as those older adults or those with compromised immune systems, they do get sick and can have lasting effects from the virus. One such condition was a Red Sox pitcher, Eduardo Rodriguez, who had heart conditions after contracting COVID-19. 300,000 children in America have contracted the disease. Those children have the ability to spread this disease to their parents, grandparents, siblings, and friends. A very small but significant number of children have developed longer-term health issues as a result of contracting the disease. Testing over the past 2 weeks in Revere has increased by 55%, and we have seen the daily new case average triple. The more people who get tested, the more we can trace and track this pandemic spread, and the more we can learn from that. Please get tested, please wear a mask, please social distance, and do all the above in order to protect yourself, your family, and the community. I'd now like to welcome up Joan Quinlan, who is the Vice President of Community Health at the Massachusetts General Hospital.
Thank you, Dr. Kine, and thank you, Mayor Arrigo. I'll be very brief. I want to say, on behalf of Mass General, congratulations to Mayor Arrigo for making these difficult decisions. I think we all know what we have to do: wash your hands, wear a mask, social distance. But we need our leaders to be telling us this and to be modeling this for us. And Revere is lucky to have a leader doing that for them. Mass General stands ready to help in any way we can. We've already gotten 15,000 care kits into the community with 60,000 masks. We plan to keep them coming in the thousands. We were proud to help Revere and Chelsea with the isolation hotel on Route 1 during the worst of the pandemic, and we provided the medical and nursing care there and hope we don't have to do that again. And we are incredibly proud of Dr. Kong, who's a physician at MGH Revere. Excuse me. So please feel free to call on us in any other way, and thank you. Let me introduce Mary Casesso, who is Chief Community Officer at Cambridge Health Alliance, another important provider in the community.
Even donning and doffing, we have to pay attention to how we do it. Thank you all for being here. It is my pleasure to be here to support the mayor in his steady leadership and his vigilant measures. It is so important, and so many of the communities that Cambridge Health Alliance serves in the Metro North are suffering from an uptick. And it is families that are essential workers, that are going out, that are worried about high rent prices, about food. And so we do have to all support these measures. We'll all get up here and say the same thing: wash your hands, be outdoors rather than indoors, social distance. On Saturday, we have our monthly free Revere produce market with our two partners at our health center in Revere, Greater Boston Food Bank and Tufts. We worked diligently to keep in mind the measures the mayor has talked about: social distancing, masking. We put in information and masks into the free food we're producing. But the one fact I want you to hear loud and clearly is that from pre-pandemic till now, our numbers have increased over 101%. People's need are huge. And so we have to be as vigilant, supporting the mayor and his commitment to take seriously all of these measures for the safety of the families in Revere. So thank you all for being here. Mayor, we pledge our support in any way that we can help you with your steady hand, vigilant measures to protect the community. Thank you.
Thank you. Diane, do you want to say it? I'll now invite our superintendent of schools, Dr. Diane Kelly, to say a few words.
Thanks, Mr. Mayor. On behalf of the school department and the school committee, and especially the high school staff, I just want to say that we're really devastated about losing our graduation opportunity on Tuesday. But we are going to spend the next few days coming up with a plan that we can honor the seniors and make sure that we celebrate their great accomplishment. As far as returning to school, I'll be continuing to work with our reopening teams and the school committee to find the best path forward for all students and make sure that we can provide some programming, particularly for our high need, special needs and English language learner students that might be able to occur in person while the majority of our students are learning remotely. And we will, of course, work closely with teachers and administrators to develop a remote learning plan that will help our students find the academic success that they need. Thank you very much.
Mayor, you're obviously making some tough decisions. Do you think the state should be making some decisions, perhaps reviewing the gathering rule or even rolling back to phase 2?
So what we've learned through this pandemic is that we know a little bit more on the local level, and I think if you look at what cities and towns have done, they have been acting with the data that they see, and so we see it on I guess a micro level, and so we have to act a little bit quicker, and I think that's our job, is to act a little bit quicker, and that certainly informs what happens at the statewide level. And I think what we're seeing and the trends that we're seeing are not, we're not alone. We see other communities, Lawrence, I know, and Brockton have seen increases. Lynn has seen an increase in their positive rate cases. So I really think that what we're seeing is happening throughout the Commonwealth, and it is a precursor for some of the things that may have to happen statewide.
Mayor, is it parties? Is it the warmer weather? Is it a function of density? Is it the beach? Why do you think this is happening?
Yeah, that's a great question, and I think everyone assumes that it's the beach because we have a lovely beach and because we've had great weather this summer. What we do know through our contact tracing team and through our emergency response team is that a lot more people are positive who have, as Dr. Kong alluded to, been at a gathering or at a party or some kind of social event, and that has been producing more positive cases than anything else that we've seen. And that one case of one individual infecting 20 other people through work and through other gatherings really is a great example of what's happening, I think, in Revere and what's happening in other communities.
People are partying because of weather.
I would say that people are enjoying themselves, and there's a lot of fatigue, right? People have been holed up and quarantined and have been inside for an awful long time. That's why it's important for us to take these actions, make people know that there are difficult decisions that have to be made. It breaks my heart to cancel or to suspend all of our programming, especially programming that includes our high school graduation. But it's a responsible thing for us to do at this point.
Would you consider closing?
So we have been in constant communication with our partners at the state level, and at our request, we had parking shut down on the beach in April and May. I will continue to advocate for the beach to be a safe place for visitors and for the residents. it ultimately is going to have to be a collaborative effort between the state and the city, because we don't have control over the state and over the beach.
Tell us what this weekend of awareness will really look like. Are you going to be out there with the bullhorn again, or what are you going to?
So we'll have Mobile City Hall out with a new message around what's going on in the city. We've worked with the Department of Public Health. They will have some additional presence down the beach. We've actually had a great ambassador program with the Revere Beach Partnership, who in a normal world they would have enjoyed the Sand Sculpting Festival. Unfortunately, that didn't happen this year, and they were able to pivot from planning that event to planning an ambassador program to make sure that there's a hand sanitizer down the beach, and that people are getting masks and have the availability to have masks. So those are all efforts that will continue throughout this weekend.
Mayor, so with the schools, so does this mean that return to full in person is completely off the table now? It's going to be either hybrid or remote?
So as Dr. Kelly alluded to, what we're planning for is that the vast majority of students will be learning remotely. In the event that we can have children who either through real necessity may need to be in the building or may need to be in a building, those are options that we're looking at. But there are a lot more details to come out, and we're going to have to. I know Dr. Kelly, the superintendent, will be doing a lot of work to get those details out to our families and to our students.
What do improved numbers look like for you?
That's a great question. I think if we see our positivity rate jump down to or drop down to below 5 or 3, that's kind of I think a more comfortable spot where we'd be in that range between 3 and 5. Having it over 6 and at 3 times the state average really is concerning, and that's why we're taking these drastic measures.
Just so I'm clear, it doesn't look like the beach is a major concern for you. It's really the gathering.
Yeah, the information that we're getting from our contact tracing team is that it's more centered around the gatherings that are happening, and gatherings like graduation parties, like birthday parties, and just friends getting together really can make these numbers continue to increase. All right, great. Thank you, everyone.